Hello again, everybody. Dr. Randy Wurts in Thrive Chiropractic. Hey, I'm going to talk about an issue kind of really sensitive to kids, and it really plays a part on their self-esteem. And I know some people or know some parents that had some issues with kids like this, and it's very frustrating for the parents, but also for the kids because it really affects, like I said, their self-esteem and their ability to socialize. It's called bedwetting, or actually the real scientific or clinical word for this is nocturnal enuresis. So let's just call it bedwetting, okay? So bedwetting will affect 15% of the kids at the age of 5. So like the kids that are going to kindergarten, 15% of them, almost 1 out of every 5 will have issues with bedwetting issues. Now, with bedwetting, there's multiple reasons why this happens, but number one reason is this: they have increased CO2. Carbon dioxide is building up, meaning they can't get the carbon dioxide out of their body. So this will affect the smooth muscles, and it's the smooth muscles that actually hold the bladder closed. They're actively holding the bladder closed to release so the urine doesn't expel at night. So what happens is we get obstruction of the airways or issues with breathing. Kid will have a tendency, your child will have a tendency to evacuate the bladder and wet the bed, so to say. So that's a probable cause. So you see kids with tonsillitis or chronic tonsillitis that have obstructions. This can sometimes happen to those kids, or chronic sinus issues, because they're not able to expel the CO2 gas, the carbon dioxide gas, from their bodies as well. Now, I've also seen cases where kids have emotional distress. And emotional distress, for whatever reason, they're not able to hold their urine contents in at night. So addressing that is another issue. You'll see kids, maybe foster kids, that they move from time to time, or kids that maybe their parents are divorced and will start to have issues with separation anxiety, which is normal. You know, you should have issues with being away from your parents and separated. That's not secure. Children want security. So that's a possible issue too. A retained primitive reflex is also another issue. So there's a reflex called the Gallant reflex. That's Glants. I'm going to put a website. I'm going to have some issues or some postings on my website as well. So I'll include that link, but it's Gallant reflex. And it's actually a retained primitive reflex that the child will retain. It's actually along the loin of their back, along the lengthways in their back. And if you're stroking your kid's back and they're age of 5 and they're ticklish, or they're moving around, or they crinkle their back, that's a pretty positive sign. And so those are issues that the kids will have problems with bedwetting. You'll see that in kids with autism or genetic disorders, but also other kids as well that seem normally fine, but that have those retained reflexes. I've seen this in adults. Not the bedwetting per se, but that retained reflex. I'll see that in adults as well. So one side will be ticklish and the other side won't be. So that's a possible reason why your child may be wetting the bed too. Other ones are nerve flow. Hey, are the nerves really working well with your body? Are they working well with the child's body? And it's just like having you hit your funny bone, right? Well, kids falls down on their butt, they jar their tailbone, and hey, that will have a shock wave, and it kind of affects the nerves that control like the bladder or the muscles around the bladder. And it could be a damage that it's oversensitized. And we see kids like that have issues with their tailbones that actually start having issues with bedwetting as well. Falling down the steps, going down the pillow like I did as a little kid, they actually have problems later on. So those are some things that you can call or talk to me about if you think that none of those other things are showing up. You definitely, I would be able to help your kid with issues with bedwetting. Now, some of the tips that you can do: make sure they're breathing at night, make sure that they're getting a steady airflow. So that's a possible tip. You also limit the amount of water that the child takes before bed. If they have to have some, if their mouth is parched, maybe just take a little bit, limit that amount, because that will have an effect as too. Make sure they're getting counseling. If they don't feel comfortable talking to you, talk to somebody, check for the Gallants. And like I said, if the nerves are an issue, I'd be happy to help and consult in any way. Hope this was helpful for you. Definitely a serious issue. And it's frustrating for the parents as well. I can definitely empathize with those families that have this issue. Take care. Have a wonderful day. Bye.